Hi, Dr. Tsolas. How are you?
Hi, how are you?
I'm doing great. Thanks so much for joining me. I'd love to learn about Rose Hill Psychological Services. Can you share an overview of the work that you do at your practice?
Yes, of course. And thank you for making the time. Rose Hill Psychological Services is a group of therapists, of psychodynamically oriented psychotherapists. We work very closely with each other, so we know each other's work. We meet regularly every day. The educational component is a very important part of our practice. So we take psychotherapy with passion and zeal and curiosity.
And I understand that your practice philosophy is a really important component. Can you share a bit about that?
Yes, that's something that I would like to talk about. What we specialize, if there was a specialization that I would like to explain a little bit more about, is the art of listening. We are psychotherapists who train and have to be trained to be able to listen to our patients in what gets them stuck in their emotional world. We feel that people do not really need to come to a therapist and hear an advice or a script of some kind of of a list of things to do. They could find that from the internet. They could find that from other sources. Uh, Usually, when people seek psychotherapy, is because they know what to do, but they can't do it. So they feel stuck. And that feeling of being stuck makes them then feel angry at themselves and feel depressed. So anxiety and depression is very much related to people's inability to do what they want to do. So in the art of listening, what we do is we listen to the blockage points in every individual. And in order to do that, we have to go beyond the symptoms that they present. So we have to listen to the person as a whole person. We'll have to be able to listen to how that person relates to the friends, to their family, to hear the background history of how they grew up, the unique story, because each person has a unique story. And then with that, to help them listen to themselves. So our goal in therapy is to be able to help someone to leave psychotherapy with that kind of skill, the empathetic listening, to be able to listen to themselves. Because later on, there are going to be many obstacles in their lives, right? Life is always obstacle after obstacle. So to have that kind of skill, to be able to have the empathetic ear towards their own thoughts and feelings, then they could do whatever they would like to do. So that is our aspiration in psychotherapy. That's what we do, more or less. That's what we're passionate about.
Wonderful. And Dr. Tsolas, do you have a message for clients who are considering starting therapy or considering, seeing your therapist?
Yes, I would like to say that if you already have made the choice to call or to make that decision to see a psychotherapist, you already are on the other side of, let's say, of you already have made a very big developmental step in achieving what you would like to do in life, because already shows that you have the desire to change your life. You have the desire to grow. You have the desire to reach to your own true potential and to do more, and you know you can do more, and we're passionate in helping you to achieve that. So you have the desire and we have the passion. So I think that is what we practice.
Amazing. Thank you so much, Dr. Tsolas. I really appreciate it.
You're very welcome, and I really thank you for asking me the question, so I had the opportunity to think about and to tell you about it.